AP 120, Chapter 19, Topics: Birth Control, STDs, and Pregnancy. Birth control is the voluntary regulation of the number of offsprings produced, and it usually requires some form of contraceptive to either avoid fertilization or to prevent implantation. Now, there are a lot of different approaches out there for contraception. There are some low, not very effective approaches, such as coitus interruptus. This is where the male withdraws and the external release of semen. There's also the rhythm method, where the female records things like body temperature to figure out when she is least likely to become pregnant, and then they only have sex during those times. There are mechanical barriers to block the sperm from making it to the oocyte. These include the male and female condoms, the diaphragm, and the cervical caps. These are relatively effective, sort of medium level. So a lot of times they're not used quite right. There are chemical barriers, the application of creams, foams, or jellies that have toxins in it that will kill the sperm. Not very effective by themselves, but much more effective in combination with mechanical barriers. Then there are the very effective combined hormone contraceptives, chemical reens, the patch, oral contraceptives, basically the pill, basically various approaches to have the female trick her body into thinking she's pregnant so that ovulation doesn't occur. And then another very effective approach is the intrauterine devices. This is a wiry device that is placed in the uterus by a medical professional. It causes a slight inflammation of the lining of the uterus that will prevent implantation. And in addition, the IUD is toxic to sperm, so will kill sperm as well. The extremely effective approach, though, is surgical methods, aka sterilization. These includes vasectomy, where the ductus deferens are cut, preventing sperm from leaving the scrotum, or tubal ligations, where the uterine tubes are cut and ligated and preventing the oocyte from making it to the uterus. They are extremely effective, but not 100% effective. Really, the only 100% effective approach is abstinence. All right, sometimes a woman will become pregnant and experience abortion. This is premature expulsion of the products of conception. This can be spontaneous, such as a miscarriage, or it can be induced. When it is induced, one way to do this is the abortion pill, RU486. These pills can be taken up to 9 weeks into the pregnancy, and it causes the inner lining of the uterus to slough off. You lose the inner lining of the uterus, you lose the developing embryo. Later in pregnancy, there are other approaches that can be used, such as vacuum aspiration and dilation and evacuation, where a tube is placed inside and removes the inner lining of the uterus, the embryo, and the placenta. There's also late-stage abortion, which is similar to dilation evacuation, except usually something is used to kill the fetus, saline solution injection or some sort of medicational injection, and then basically inducing labor to help in removing the aborted fetus. And then the final approach, also known as partial birth abortion, is the intact dilation and evacuation, where the fetus is partially removed and then the brain removed, killing the fetus before it is completely removed from the female's body. All right, another consequence of sexual activity can be sexually transmitted diseases. Here's another argument for the use of condoms. So, for instance, there is chlamydia. Chlamydia is a bacterial infection where the bacteria actually grows inside of the cells, inside of the host cells. It can be asymptomatic, so someone could be infected and not know it, but it can lead to things like growth and disruption of the skin on the external areas of the male or female reproductive organs can lead to inflammation within the uh, pelvic region of the female or within the urinary tract of the male, reproductive or urinary tract of the female. It is possible to cause infection within the mucous membrane of the eyes or also within the mouth or oral cavity. And also, there's often a mucus discharge. But this is curable. Good thing. Then there's gonorrhea. Gonorrhea is another bacterial infection which leads to a mucus discharge from the cervix or the penis. Again, can affect the mouth and throat, the genitals, the rectum, the eyes, mucous membrane of the eyes. As a matter of fact, it can be spread from an infected female to the eyes of an infant during childbirth, which can cause blindness in the infant. Nowadays, they test to see if the female is infected with gonorrhea ahead of time to prevent that from happening. And by the way, gonorrhea is curable. Then there's syphilis, another bacterial infection. Syphilis goes through 3 stages. Usually the earliest stage is the formation of a canker, a open painless sore wherever the infection may have occurred. Since it's painless, it might not be noticed. Then that'll go away, and then the second stage will lead to skin rashes in the genital or infected areas, but also elsewhere on the body, fevers, body aches. During stages 1 and 2, syphilis is curable. However, if it moves on to stage 3, the tertiary infection, then the syphilis will have spread to many other organs in the body, such as the brain, leading to organ degeneration and eventually death. Then we have genital herpes. Genital herpes, caused by HSV-2, is a viral infection that causes painful blisters. This again can occur in the genitals, the rectum, around the oral cavity, in the eyes, I suppose. This is a viral infection that is incurable. It is, as they say, the gift that keeps on giving. Then there are genital warts, HPV. This is another viral infection leading to wart-like growth around the genitals or wherever the infection may have occurred, although it is possible for it to spread to other areas of the body. It can cause cervical cancer in women and, in rare cases, penile cancer in men. Again, there's now a vaccine out there given to children to prevent this infection from occurring. Pregnancy. Well, we're just going to talk about it briefly. After the oocyte is fertilized, it becomes a zygote. As it travels down the uterine tube, it will divide many times, forming a ball of cells called a blastocyst. This ball of cells is actually what will embed into the lining of the uterus, and in that process begin to form both the embryo and the placenta, and of course the production of the human chorionic hormone. Here again is the embryo, the placenta, embryo, placenta. Before conception, before the female becomes pregnant, the uterus is relatively small in the pelvic cavity, about the size of a woman's fist. Then as the fetus develops, the uterus will grow, taking up more space within the abdominal cavity, continuing to take more and more space up until finally the uterus actually grows enough that it's directly below the xiphoid process of the sternum. This obviously causes a massive amount of shifting and compression of important abdominal pelvic organs in the female. Then during childbirth, during labor, the infant will reposition itself so its head is pointed downward, pointed toward the vagina. Then during contractions, during muscular contractions within the uterus and the abdominal walls, the fetus will be, or infant will be pushed out toward the vagina. During this process, the cervix will be dilating until it has spread out enough that the head of the infant can then enter and pass through the vagina and be born, as it were. And then a little while after that, there'll be some more minor contractions that lead to the release of the placenta and umbilical cord. And that, of course, leads to lovely, beautiful infants, which is the real point of the reproductive system after all. And that is it for this lecture and this course.